This is Nursing Uncensored. I'm your host, Adrianne Benning, and I invite you to listen in on conversations I've had with real nurses about the crazy and wonderful lives we lead. This podcast is meant to create laughter in addition to serious discussion, and nothing is off limits. We're always honest, but we're not always safe for work. Please listen responsibly. Welcome to Nursing Uncensored. Today, we are going to spend a little bit of time with return guest Iman Abuzeid. She is the co-founder and CEO of the career marketplace for nurses, Incredible Health. If you've been around a little while, you'll remember the episode that I did with her about 8 months ago. We talked about Incredible Health, the nursing shortage, COVID. We covered a lot of stuff. We also talked about the free CEU portion of the platform, which we will also talk about a little later. And today, Iman is back to talk about a pressing topic that is affecting all nurses in this ongoing pandemic, which seems to be just raging on endlessly. So let's get right to it. Welcome back to the show.
Yeah, thank you so much for having me.
I'm glad to see you. Yeah, it's like old friends. Whenever I have guests back on the show, I'm like, hey, let's do this again. So I'm glad that you had the time to talk to me and all of my listeners today. So will you kind of catch our listeners up, the newbies in the Nursing Uncensored crew, and kind of tell people about yourself and your company and the work you guys do?
Sure, absolutely. So I'm an MD by background, and I'm the CEO and co-founder of Incredible Health. And what Incredible Health is, it's a career marketplace for healthcare workers. And what that means is hospitals and health systems, they use our software to hire nurses in permanent roles in 20 days or less. It normally takes them 80 days or longer because there's such a massive nursing shortage. Mm-hmm. We are the fastest growing career marketplace for healthcare workers and for nurses specifically in the US today. And our secret sauce has a lot to do with our software and our technology. We're able to automatically screen and pre-vet the nurses, as well as we've built very robust custom matching algorithms. And all of that is used, as well as many other features. And that's all used to accelerate the hiring of permanent nurses, given the huge shortage that we find ourselves in today.
Mm-hmm. And like we talked about before, I think the shortage started long before the pandemic did. And so a little bit later, I'd love to talk about some of the trends that you've been seeing. But first, I want to talk about the topic at hand. So Incredible Health, once again, you guys noticed kind of an underserved area of what nurses are experiencing during this pandemic. So I've taken a casual scroll over the resources we're about to talk about, but would you just go ahead and maybe talk about the latest additions to Incredible Health?
Yeah, absolutely. So our mission at Incredible Health is to help healthcare professionals live better lives and help them find and do their best work. And so, we've really evolved from being as opposed to just being the place where a nurse finds his or her job, permanent job, we've really evolved to be the place where a nurse manages his or her career. So you mentioned earlier that we added things like continuing education that's free and available to every nurse, and it's accredited in all 50 states. And they can just use, they can access all of this in the iOS app, the Android app, and on the website. Now, we just continuing with that theme of continuing to add free services and tools that nurses can use to help them to help them out, is we added two key features that really help with mental health and burnout this time. And so the first is the Incredible Health Nurse Community, which is a free social network that's built exclusively for nurses. And then we also added the Daily Nurse Journal, which is a free digital journaling platform that nurses use to categorize and document their feelings every day. So I'll talk through, before I even dive into those features though, I just want to talk a little bit about nurse fatigue and burnout and
Please
that
do.
topic.
Yeah.
And it's like a critical topic for this workforce in particular, especially now in the middle of a pandemic. But even before the pandemic, burnout was a very, and workplace stress was a very real issue and problem for nurses. So just a couple of stats, so in the beginning of the pandemic, like around April 2020, the team at New York Presbyterian did a pretty detailed study on healthcare workers and nurses specifically, when New York City was going through that very intense like peak of COVID-19, when the pandemic first started.
Mhm.
And what they discovered and published that nurses were among those that reported the highest levels of stress of all healthcare workers, with 64% of the nurses reporting symptoms of acute stress. And so that ranged from nightmares to the inability to stop thinking about the virus. And so, like, we cannot underestimate the impact that this pandemic has on the mental health, the workplace stress, the fatigue, the burnout that nurses are going through. And it's something that existed before the pandemic because of the shortage and nurses are overworked and so on, right? And so, in response to that, we wanted to add these two products that help support the mental health of nurses.
And the things you're describing are things that I've even experienced, and not to measure pain, but I'm not even working in the COVID ICUs. I work a step down unit. So a lot of the patients that I see and take care of are mostly stable. They're not ICU level care, but they're far from being able to walk out the front doors. So
Yep.
I know that that's taken a huge toll on myself and my coworkers. And some of us are dealing with it better than others. I particularly feel like I'm experiencing this acute stress. It's weird. It's like acute on chronic, that phrase that we
Mhm.
use in medicine,
Yeah.
because obviously, like, we've got these coping mechanisms that we develop, and sometimes those just don't work anymore because we're tired. We have this like pandemic fatigue where we're just sick of the precautions and the restrictions. And so even if we maybe don't notice it because we've been coping for so long, but I think that it's always a good idea to introduce new ways to try to handle those emotions. And I
Yeah,
know
absolutely.
that I'm going to let you talk a bit more about these services, or about these features on the platform. But when you're done, I want to talk a little bit about my feelings about like my first impressions from using these resources, because I
Oh
think I
yeah,
have some interesting
absolutely.
things to say. So yeah, and I know that
Yeah, so
burnout is something that that you're hearing directly from nurses. Like you're
yeah,
in the thick of it.
we are in the thick of it, and we do hear it from nurses, and I'm sure a lot of your listeners that are nurses have also experienced it as well. And it's, we're all, regardless, even if you're not a nurse, like there's
Mhm.
some level of mental health strain that's going on during this pandemic.
Yes.
But like when you are faced with COVID every single day at work, that just brings it to another level
Oh
of
yeah.
mental strain. Um, and so, one of the features we added is the Incredible Health and Nurse Community. And this is a free social network that's built exclusively for nurses. Nurses can go on there and, like, honestly give each other support, give each other advice. And nurses have the ability to post anonymously too. So it's a very safe environment. Employers can't see what's being posted. And so it's exclusively just for nurses. And there's topics in there that range from, how do I transition from one specialty to another? There's how do I cope with, fatigue and work and burnout? And then there's like really fun topics too that are being discussed in there, like what is your favorite scrubs brand, and
Mhm.
like some of these other lighter topics too. And so we noticed that there isn't one place where nurses congregate online that's safe. And so we wanted to be, because the Incredible Health platform already had, hundreds of thousands of nurses on it. We figured that adding this community would be a helpful place for them to interact with each other, because, to be perfectly honest with you, the biggest advocate of nurses is other nurses. Like,
Mhm.
you guys are a very supportive community, and it's just been like a pleasure adding like an online framework and an online platform to what's already there. Like, nurses help each other out.
And I was scrolling through the message boards, and I catch myself reading things that like don't even have any real application. Like you said, switching from specialty to specialty. I'm like reading the threads just because I'm curious, not necessarily
Yep.
because I'm interested in that specialty. So it's been really it's a nice sneak peek to see what other nurses are talking about, even if I'm not posting myself. Um, but it's nice to know that, like you said, it's not viewed by employers, which, when you're even in private groups on Facebook, it feels so large and open and vulnerable, that it's difficult to really feel comfortable being honest in these message boards. With Incredible Health, like, to sign up, like, is one thing, but to sign up and look for jobs is one thing, but all of these services are free. And so this
Yep.
community exists regardless of who is using the platform to find new jobs. So you don't have to be hunting for a job for this message board to be beneficial to you. So I really like that aspect of
Yeah,
this.
absolutely. Thank you. Yeah, I mean,
Yeah.
we'll hopefully you can use it and feel free to be as active as you like in there. I mean,
Yeah.
one of the coolest things we've seen is like, of course, like there's new graduate nurses in there, and so the nurses that are more experienced are giving them great advice. We're also seeing things like, let's say someone who does want to transition to say labor and delivery. The way the notifications works is that we're notifying the other labor and delivery nurses on the platform, and so they're like tagged almost to come back and like provide their advice because they're the experts in the area, right?
Yeah.
So it's been like a real pleasure like watching that evolve, and we're going to continue adding more and more features and to it as well to keep making it more and more useful. um the second feature I want to talk about, or the second service I wanted to talk about that's also 100% free, is the daily nurse journal. And this is the ability for a nurse to effectively log their his or her emotions on a daily basis and their thoughts and feelings. And there's also a ton of academic research that shows when you do this sort of journaling exercise on a regular basis, and honestly, even if it's not even regular, even if you're just doing it sporadically, that has proven to reduce workplace stress and fatigue. Um, and so it's really a lot of prompts in there that help nurses answer questions about their workday, about their shift, and it's almost like a way to like sort of vent into into the journaling app. Obviously, 100% secure and private, and not shared with any employers or anything like that.
And I'll say, so I did my first entry today. I'll be honest. I'm new to it. I've been cruising the message
Okay.
boards, but I hadn't taken the plunge to the daily check-in. But it makes me think of, like, I'm a journaler. I love prompted journals, and I love thinking about things that maybe I've forgotten. So it asked me how I was feeling, and to be completely honest, I put things down like depressed, tired, whatever. I'm not having the best day. And then it asked
Yep.
me to talk about an achievement recently in my career. And the first thing I thought of was, oh, in the last 2 semesters, I've had senior nursing students follow me. They had great experience. They told me they had great experiences and they felt they got really lucky. Okay. I wrote like 3 sentences. It changed my mood,
Yeah.
because I hadn't been thinking about that. Like, I hadn't had somebody say, "Hey, what's something you feel good about today?" And so, not that it's like a miracle, like, "Oh, magically I'm not depressed," but I think is an example that these tools, these daily check-ins, these prompts can actually, not only directly affect our moods, but can maybe this was a thing I was thinking is that, yeah, it's completely private, but having things kind of like spelled out for you in ink is not only helpful for me to recognize trends, like, oh God, I've been putting in depressed like every day for the last like 4 weeks. Maybe I should do something about it. But then I can
Yep.
even use this as a tool to go to my doctor and be like, look at all this stuff that I wrote. Like, look at this overall tracking of my moods. And then we can
Yeah.
use it as a tool. I mean, maybe I'm extrapolating in an extreme degree, but I think that that's what's valuable about something as simple as this like daily journaling tool.
Yeah, I mean, I love the example you gave. I mean, I think yes, if you can think about some of the positives and what you're grateful for, what's going well, that alone, that prompt alone can lift your mood.
Yeah, just I mean, putting things in the forefront of your mind that maybe your stuffy bad mood wasn't allowing you time to think
Yeah,
about. So yeah, I like
absolutely.
these additions. I think it's fantastic that Incredible Health has been growing. Like, you keep adding these things, you keep adding these tools. And I think
Yeah. Mhm.
I mean, that's a sign that you guys are listening and paying attention to what nurses need, or at least trying to be innovative in what you're offering.
Yeah, absolutely. So look, this is I'm an MD by background. Like a lot of my family members are doctors, and my co-founder, who's a chief technology officer, Rome Portlock, he's a software engineer, and he has several family members that are nurses. And at the end of the day, like we've been around healthcare workers our entire lives, basically, right? And
Mhm.
this is just a group of workers that have been overworked and underappreciated, And we just want to be the one service, the one product out there that's giving them an amazing, delightful experience. And that could be a delightful job search, or it could be, any of these free services that we're providing as well. And so there will be more and more coming. We want to continue innovating in
Mhm.
this area. And we do want to, at the end of the day, the goal here is to be the, category defining, market leading company in healthcare labor. And we're starting with nurses, we're starting with some of these services first. But the goal is to, ultimately achieve that mission of helping healthcare professionals live better lives and helping them find and do their best work.
And to kind of back up and broaden our view of this, I think,
Mhm.
and correct me if I'm wrong, I thought I saw something on the website that said you guys are working with like 250 hospitals. That's been, or healthcare institutions, maybe not hospitals, but that's been growing. So, what have hospitals been saying about the nurses that you're connecting them with? I mean, good experiences, I'm assuming, because this is continuing to grow.
Yeah, absolutely. So we work with over two. You got it right. Over 250 hospitals and health systems use our platform, and we've expanded across many states at this point, right? So I think when we first spoke 8 months ago, we were like in California and Texas. We've
Hmm.
now added Florida and Louisiana and Maryland and Iowa and Colorado and Nevada. We'll be in 13 states by the end of this month. We'll be in more than majority of the country by the end of this year. So there's rapid expansion going on because we had a lot of success in California, which is our first state,
Hmm.
and then again in Texas, and then we just want to bring the service to the entire country. Now, when it comes to the employers, the reason they love this is because the software does a lot of the heavy lifting for them, right?
That, yeah,
Hiring nurses has not really changed very much since the early 90s. It's like post a job, hope something happens.
months,
You
months.
get months, and you get a lot of if you're just from the hospital's perspective, you get a lot of applicants. You got to sift through all of that manually, and you got to match manually, and it's just highly inefficient for the types of employers that we work with, which are hospitals that have to hire quite a lot of labor every single year.
Mhm.
Um, and so by providing them this this software and technology that pre-vets the candidates on their behalf, that matches them, custom matches, that provides things like automated interview scheduling, that provides remote interviewing options, and so on, but like a full suite, including data analytics and so on, we're really able to accelerate the hiring from the national average now that's 80 days to fill a permanent specialized experienced
80
nurse position.
days? That's the
Yeah,
average? Oh,
that's the average
man.
for permanent and specialized and experienced. That's the average. And we bring that number down to like 20 or less.
And if you're trying to move, you don't wanna necessarily, if you're, like, looking to relocate, I mean, some people might be planning that far out, but, um,
Yeah,
if
it's
you're
too
if
long. I mean,
it's too
yeah,
long, yeah.
it's too long. If you, and that's lucky. You're lucky if you even hear back, right? Like
That's the average, so
usually,
that means that there are
yeah,
definitely numbers above that number. Um,
yeah.
so what are we seeing a lot of nurses looking for, like, remote jobs? Are you seeing a shift from, like, a major shift? Because I've seen a lot of headlines that say, like, "Nurses are burned out. We need to expect that after this, we're gonna expect a whole bunch of them to shift away." Are you noticing any change in demand on
Yeah,
that side?
yeah, there have been some pretty big changes. So, as a result of COVID. So, first of all, the demand for specific specialties has gone up, and then for other specialties,
Mm,
has actually
mhm.
dropped a bit. Actually, so for example, ICU, ED. I mean, sorry, intensive. I'm not sure about your intensive care and the emergency department. I shouldn't use
Yeah, yeah,
acronyms.
mhm.
Um, has really spiked in demand. It's gone up by at least 3x on our platform alone. It's probably the same across the country.
Yeah.
And those are highly sought after nurses right now. Now, OR nurses, there was a slowdown with OR nurses at the very beginning of the pandemic when elective surgeries were paused and so on. But that's like come roaring back since like
I
midsummer.
bet. Yeah.
Um, and so we've seen these like fluctuations in demand, and yes, absolutely what we're seeing overall is a dramatic increase in demand for nurses in the early days of the pandemic, when it was only impacting, say, the northeast of the country. It was easier to move nurses around, and the travel nurses were very popular, right? Now at this point, it's now what, January
Mhm.
2021. the pandemic is completely widespread throughout the country. Every single state is struggling. Every single state has community spread. There is just simply not enough nurses to go around. And this whole shifting of nurses from one place to another it's not possible right now because everyone's doing high demand.
Yep.
And so that's like some of the bigger like changes and trends that we've seen. Another one that we've seen is, yeah, you're absolutely right. Nurses leaving the workforce, which is like the last thing we want to hear, right? Given the just ongoing shortage even before the pandemic. And a lot of that has to do with the burnout and the fatigue. Every single chief nursing officer that I interact with and that we interacted with here at Incredible Health reports reduced retention. So that means they're seeing higher turnover, nurses leaving. And all of that is completely related to just being overworked. Now, some positive news, though, is because the pandemic has been in the news so much this year, and nurses, healthcare workers have been at the forefront when it comes to the mainstream media, we are seeing a spike in applications to medical school, to nursing school. So like we've actually increased the interest of people who want to become nurses, which is overall a good thing. Of course, we got to figure out how the nursing schools can expand their capacity to train more because they don't have any capacity right now. But that's really a positive trend.
Absolutely. And I think that even the students that I've worked with or the students that I've talked to, whether it be in person or through email, they all have this unprecedented like excitement because not only are they coming into this career that they've been working towards, but they do get to kind of be like the relief pitchers. They're coming in kind of bottom of the ninth, and I don't know where that baseball reference came from. I'm not a huge sports fan, but anyway, the example stands. Like they're kind of coming in, and even though it's an incredible challenge to start a new job when acuity is so high and things are so uncertain, but I love the enthusiasm that's coming from these new grads and these soon to be graduates. One of my best friends who lives in Minneapolis is about to take her boards. I mean, she takes her boards in like 12 days. And I'm so excited for her because even though she's very realistic about what work is going to be like, the shortages, the demands, the need for overtime, all of these things, she is she's that breath of fresh air. She's that new blood coming in to kind of relieve us tired, kind of worn nurses. So I'm really hopeful for the new kind of generation of healthcare providers. And it makes me really happy to hear that applications are up for all these different disciplines of medicine. We need people. So if you're listening and you're thinking about it, start to make it happen. Start doing it. And if you got the itch to go somewhere else, I mean, this is an unpaid interview. There's no sponsorship happening at this time. And I can honestly say that I am passionate about Incredible Health. And I look forward to using Incredible Health in the future to find my own job. I've been a little bit nervous to start filling out my profile on the app. But I mean, every time I read something new or I cruise the message boards, I'm like, maybe I should start filling things out. So
Yeah.
it'll happen.
That's great. Thank you for saying that. I appreciate it.
I think it's really
important.
Love it
when we
there's so much social media. There are so many influencers that are like, buy this, try this, but there's not really any indication of why. And I feel like all we've been talking about is why this platform is such a good tool for nurses. And the fact that you don't have to pay a membership fee, donate here, do this. You don't have to do these things to access this information. So it is great for all nurses. So that's why I'm like shouting it far and wide through this podcast, Mike.
Yeah, absolutely. And yeah, it's 100% free for nurses. And like, I think the part that the nurses love the most in terms of the actual hiring product itself is that the employers apply to them instead of them applying to the employers. So it really does give the nurses the upper hand, more control, more autonomy in terms
It
of
even
in terms
changes
of their
the
job
way it
search.
feels. You feel valued when you have multiple people
Yeah,
say to you, like, hey, we're interested in what you have to offer. So, do
yeah.
you have any
And you get to
advice?
choose
Yeah,
which
you get
interviews
to
to
pick. You get
accept.
to pick. You get to say, be gone, but I will take you.
Right.
Do you have any advice for nurses who maybe are venturing out to use the platform and are starting to fill out their profiles? Like, what I know that I've heard in some antiquated hiring systems that you have to hit the keywords that are in the job application in order to like trigger a machine to pull your app. So
Yeah.
I know that that's like the old way of doing things, but do you have any advice for nurses as they like start to use your app to have these hospitals start basically shopping for them?
Yeah. So a couple pieces of advice. Yeah, I mean, just check out incrediblehealth.com. You can apply, and you can set up your profile
Mhm.
basically there. It usually takes only a few minutes to set up your profile. And then the other thing is, after our software has done its thing and done its screening, every nurse is paired with a talent advocate on our team, and the talent advocates are nurses themselves. So you will have a nurse supporting you throughout your entire hiring process. So, I mean, I know we've talked a lot about software and apps and so on, but there's like actual humans behind the scenes who are supporting you. Now, when you see our reviews on Facebook and on Google, we have tons of reviews out there, and it's fun. I love that they say we love Incredible Health, and then they always say, and Molly, like their talent advocate, like helped me out so much, and like it's been really cool to see the nurses highlight that kind of personal touch about having a career coach who's also a nurse help
Mhm.
help you get through. They do interview preparation. They help clean up your resume. They help you evaluate offers. Like it's a pretty robust service for nurses.
So utilizing that person that's kind of partnered with you is a great way to maximize use of the app. Good.
Awesome.
I'm gonna need to get one of those people on my side. Um,
Yeah,
and and delayed reaction. Did you say you guys are in Iowa now?
we are. Yeah,
Oh, so maybe I
we
might
are.
have to look now because I'm in Iowa. So I don't know. Maybe that changes how fast I'm going to fill out my profile. I don't know.
Yeah,
I also noticed that you guys also hire for like per diem jobs and some other
we
kind of
do.
less permanent.
Yeah, as
Are
long
those
as it's a permanent. Yeah, as long as it's a permanent role.
mm-hmm.
It could be full time, part time, per diem, but it's a permanent role. Like you will be the employee of the hospital or health system. We do it.
Cool. Good to know.
Um,
Good
and yeah,
distinction.
and we work with really big health systems like HCA Healthcare, Baylor Scott and White, Adventist Health. We work with many academic medical centers
Mm-hmm.
and magnet hospitals like Stanford Healthcare and Cedar Sinai, and lots of community hospitals too. Like across 8 states now. We'll be in 13 states pretty soon.
Sweet. That's fantastic. I'm so excited to see the growth that's continuing to happen for you and the folks at Incredible Health. I look forward to seeing more from you guys because it seems that this platform is really kind of cutting to the chase. And as a nurse, I really appreciate, just like I said before, the concept in general being shopped for has never felt so good.
Yeah.
So I just want to thank you again for coming back to the show. It's always lovely to talk to you, whether by email or face to face like this, as face to face as we can get in these days. Um, any final thoughts that you want to share with our listeners, or do you want to reshare your links, social media platforms, etc.?
Sure. I mean, yeah, our website is incrediblehealth.com. We're on Facebook, Instagram, LinkedIn, all the different social platforms. I do just want to say this, just first of all, like a huge thank you to all the nurses out there. I mean, 2020 was a very rough year, and 2021 is expected to continue to be pretty rough. And just it's a very stressful job, and but you're doing an amazing service, taking care of patients, and yeah, so just wanted to say thank you and how much we appreciate you.
On behalf of all the nurses listening, I really appreciate that. It's nice to hear the appreciation. We've been at it a long time, so we hope that the appreciation continues even as people get major pandemic fatigue from all of this. So, yeah, thank you again. And to everyone listening, please check out nursinguncensored.com, blogs, past episodes. We've got merch, which I've kind of been working with a few different merch companies to nail down the products that we like. But it's happening. It'll happen. But in the meantime, please check out the website and leave a review, iTunes, Spotify, wherever you happen to be listening. So thank you again, Dr. Abuzeid, for joining us.
Thanks so much for having me. I appreciate it.
Yeah, of course.